This segment is sponsored by HCA Virginia, Chippenham, and Johnston Willis Hospitals.
At least once in our lives, we're likely to experience hip pain or knee pain. New technology called MAKOplasty is changing the landscape should joint replacement become necessary. Dr. David Miller is here this morning to explain all this to us. Thank you, sir, for coming in.
Thanks for having me.
Good to see you. Well, I'm going to get into the MAKOplasty in a second, but I know you have specialized in hip replacement and knee replacement surgery here in Richmond for some time now.
That's correct.
And there's lots of different ways to kind of ease some of that pain before we get to the actual surgery part.
Absolutely, absolutely. There's Tylenol for arthritis, there's anti-inflammatory medications, there's sometimes injections, therapy, assisted ambulation devices. All those things can be helpful.
And in the past, you know, we just mentioned that hip replacement and knee replacement has become almost commonplace in a lot of situations. But like in most things, if you can work with the original and salvage that, that's probably a good way to go.
Absolutely, absolutely. And certainly, you know, keeping good exercise up. We know that patients that are in better shape tend to do better. So proper exercise and diet and weight control, all those things are very important.
All right, let's talk about this MAKOplasty and why it's different from a knee replacement or a hip replacement.
MAKOplasty is a tool. For instance, you know, we know that hip replacement surgery is probably the most successful procedure that we do in orthopedics. And so how can you make something a lot better? Well, we do that by making the procedure more precise. For instance, we know that anything that we can do to increase longevity, hip stability, leg length, and make it feel more normal is important. And so to do that, if you're more accurate on placing these components, it helps in those respects.
And the great baseball announcer Joe Garagiola once said, minor surgery is surgery on someone else. If it's on me, it's major.
That's right, exactly.
So what exactly happens when we do this? Because it's kind of resurfacing and doing things like that?
Exactly. I mean, for the knee, we're talking more about a resurfacing procedure. And essentially what you have right now, we're able to use MAKOplasty, and I'll get into that in just a second, but what we're doing on the knee side is resurfacing the joint. We're removing the cartilage that's warm and replacing with metal and plastic. And so MAKOplasty helps us to implant those components more accurately to make them feel more normal and more stable.
And back to the minor major thing there, obviously the less invasive, the better.
Absolutely.
As far as recovery time. And as you said, the quicker you can get out there and start exercising and staying active. Let's take a look at, I'm guessing this guy here is...
This is a knee replacement. It's not ready for the total knee replacement, although it's coming. Currently, we're using it in partial replacements where only a part of the joint is worn. For instance, this is the knee. And so essentially what we do is we replace the worn out portion on the inside of the knee, in this patient's case, with metal and plastic. And so what MAKOplasty does is it uses a CT scan with a 3D image, okay? And then you import that into the computer, and then you're able to place those components very accurately. And then when you get to surgery, you have a tracker that's placed in the bone so that you can range it, and then you tell the computer where the points are, and it reconstructs the knee so that you can then use it to implant these components.
This is going to sound silly. Is the part that's actually going in nice chrome like that, or is this just for the model?
Cobalt chrome.
Oh, very nice. Chrome. I got chrome. Yeah, that's cool. Yes. All right, that was a ridiculous question.
No, it's
but
not
I
ridiculous.
To ask.
No, that's not ridiculous.
And this looks like it's plastic here.
It is.
And it rotates. When I picked it up, it feels like it's very smooth and very easy.
It does. And so when you get into surgery, before you even implant these components, you're able to take the knee and you put it through a range of motion. You put it under stress. And then you can look at that on the computer, and you can tweak how the position of the components to make it more stable and track better.
I'm imagining the hip is a whole different thing, obviously, and we've only got a few seconds left. Probably not going to be able to get into it, but it's a ball and joint kind of deal.
It is. It is. And so what MAKOplasty does here is it helps accurately place the cup in the hip, as well as the stem, and it by having those in good position helps increase your longevity, stability. It centers the hip like when we haven't been able to do, so that you're more
exactly on target,
yes,
so
sir.
to speak.
Yeah. Yeah.
Well, obviously, medicine is progressing, and the point being to make it as quick and recovery as possible for the patient, and obviously we get chrome, folks, so that's
right.
good. Thank you, Dr. Miller.
Bye.
Learn more about Dr. David Miller and his work with hips and knees. Visit the office of Ortho Virginia, 1115 Boulders Parkway, Suite 115, North Chesterfield, online at richmondhipandknee.com, or give them a call, 320-1339.